Hello, dear friends. My name is Sofia Dorinskaya. I am a doctor and the head of the Center for Medical Information. Today I want to talk about this topic. In many of my videos, I often express my confusion about where people who call themselves doctors and spread outright nonsense on air come from. Some time ago, there was a woman who called herself a doctor, stood in a white coat, and spoke convincingly. To deal with insulin resistance, you need to eat twice a day. This is simply a criminal statement. And if you're interested, in this video, I'll put a link to my video about insulin resistance, where I simply explain that if you eat twice a day with insulin resistance, you'll just get wiped out very quickly. To the cemetery or some other nonsense, for example. People write to me saying that their doctor told them their child needs to be prescribed neuroleptics because neuroleptics teach neurons how to think. Thank you. There's also this expression used with celiac disease, which is gluten intolerance. Thank you. This gluten, this plant protein that's found in bread, it sticks together the villi in the intestinal epithelium. The next, nonsense that people say is that we need to cleanse the body, we need to cleanse the intestines, we need to cleanse the liver. And when I was still studying at the Institute, I entered the Institute in 1990. In 91, the Soviet Union collapsed, as you know, and then all these network marketing companies started appearing. Of course, who didn't go to network marketing presentations? And I was dragged to them from time to time. So there I am, a third-year medical student, sitting and listening to people tell me that this supplement cleanses the body. I was already starting to feel uncomfortable back then, so to speak. Because there is no such external mechanism as cleansing the body, it simply doesn't exist. The body cell, that's what it is. The process of life is to take in nutrients and release waste products. This process is always happening. It goes on as long as the organism is alive. No external force, no outside action can ever cleanse the body. The body can be cured of an infection. Infections can be bacterial, or they can be helminthic invasions, which are also a type of infection. It can be cured with a special toxin that will kill a particular pathogenic agent. Yes, it's a virus, a bacterium, or a helminth. Yes. It's impossible with viruses. There are no medicines against them. That means only the body itself can handle it with its own special mechanism. Yes. And the toxins that are formed as a result of the breakdown of those same bacteria are eliminated by the body itself. It's impossible to cleanse the body in any way, by any means. By cleaning the body externally, we can only provide nutrients and vitamins. Like non-specific detoxifiers, non-specific means that they detoxify everything, absolutely everything without distinction. These are natural detoxifiers, and the body begins to die from toxic exposure when it doesn't have enough resources to remove toxins from itself. No external washing, like stomach washing or anything like that. Well, that's situational, of course. We're just getting rid of it. We can do that. For example, if we got poisoned, inhaled something, or maybe not inhaled, like when there's renovation going on. And if you're wearing very light clothing, fumes from glue or paint can get through your body, and you start to feel unwell. Should you drink milk? Why? Because the surface of the gastrointestinal tract releases toxins, and the protein in milk will bind to those toxins. That's exactly why, in the Soviet Union, people working in hazardous industries were always given milk for free because of the harmful conditions. Why? Yes, because the body still releases these toxins on its own, you see. And if there aren't enough nutrients, The body simply can't cope with it. There are no cleanses in nature. It's just a marketing ploy. And, I kept wondering, where do they come from? Where do these people come from? I don't think they're lying about being doctors. That's actually easy to check. You just send a request to the medical institute and ask if this person has a diploma. And that's it. The prosecutor's office, prosecutor, or court can easily request documents without any issues. And what do I find out? On April 16th of this year, a publication appears on the Doctors of Russia website titled, "Where do underqualified doctors in Russia come from?" What do we read here? Currently, doctors are being trained at about 1,500 universities in Russia, 2/3 of which are not affiliated with the Ministry of Health. Currently, there are 163 universities in Russia training doctors. 46 of them are under the Ministry of Health, while the rest are faculties that appeared relatively recently and are overseen by the Ministry of Science and Higher Education. This is a disaster, comrades. This is a real disaster. 2/3 of doctors have been trained by whom? By school teachers from the Ministry of Science and Higher Education. Are you serious? Who created these programs? What departments did they have? Where did they keep corpses in their anatomy labs? If these are faculties in non-specialized universities, if it's a faculty in some railway institute, have these doctors ever seen a human corpse? What it actually looks like? Or did they just study from pictures? Have they ever completed even one clinical department? Have they ever seen a patient in their life at all? No. Who taught them? Who allowed their teachers? How long did they study there? Who wrote their programs if the Ministry of Health doesn't control this? What kind of doctors are these who tell you that you need to eat 200 grams of meat a day? So who taught them? Was it a ballet school? The Railway Institute? I don't know. The Institute of Transport Communications? Anyone but the Ministry of Health and a medical university, because not a single properly trained doctor in their right mind would ever advise or say that a healthy diet is 200 grams of meat a day, not a single doctor in their right mind. They wouldn't set up a weight loss clinic somewhere out in the middle of nowhere, in the woods, where overweight people are given water, just one apple a day, and are forced to do physical exercises. These people would leave and in 2 weeks end up in the cemetery because this has nothing to do with understanding the body at all. The catastrophe is also that, formally, these people have diplomas, real diplomas, because if they didn't buy them, there are documents proving that this person is a student. He attended all the lectures, he completed all the practical classes, he passed all the exams, and it doesn't matter who administered the exam to him. I don't know. There was a nurse who was approved just to save some money, it doesn't matter. But formally, this person completed the program, and their diploma is officially no different from the diploma of a doctor who graduated from a real medical institute. And 2/3 of the doctors are like that. And it's impossible to take away these people's diplomas because they're state-issued. The government allowed them to be given out, and no court will ever, just because someone graduated from a medical faculty at a ballet school, no court will ever revoke their diploma. That's exactly why we have cosmetic clinics now. It's just unbelievable. A woman died. She was 40, maybe 46 or 47. What did she do? She went to a cosmetic clinic. She wanted to be beautiful. Of course, women have a hard life. Nobody wants to lose their beauty. She went to a cosmetic clinic, and they told her they had a discount promotion called All-in-One Anesthesia. That means the entire list of procedures that can be done to a person's body, they do under a single anesthesia. That's the kind of discount program they have. And what happened? This woman came to this clinic. They gave her anesthesia, and during the anesthesia, for about an hour and a half, or two, they performed 36 procedures on her. She suffered injuries, interventions to her body all at once. This is an unbelievable thing. This is called butchering a person. When you study to become a doctor, and of course there is anatomy, those are the first courses. When you study the intestines, I can still see that lesson. We studied the intestines on a specimen. On a human corpse. And even back then, our instructor taught us, when we had to show the small intestine and so on, she always told us to be very careful. You have to move the intestines carefully, because they are attached to the human body. I won't say the exact words now. It's attached to the body and inside, called the mesentery sheets. But that's not important. Just inside. It's like two little sheets that somehow wrap around the intestines. Then they join together, and then they attach back there to the spine. So, inside there are a lot of blood vessels and nerves passing through, and then there's just a nerve plexus. And if you just move the intestines like that, even if the person is under anesthesia, but if you move them very carelessly, the person under anesthesia could die from pain shock. And even when we were working on a cadaver, we learned to handle the intestines very carefully, even when we were explaining or showing some parts during class and so on. She taught us how to be very careful like that. You need to move it like this, so that we immediately practiced how to handle the human body properly. Imagine that after receiving a real medical education, the clinic will start doing such promotional campaigns. All invasive procedures under one anesthesia, 36 penetrations into the body, 36 incisions. The person died from pain shock, regaining consciousness after the surgery. And then, a few hours later, she fell into a coma. She was transferred to intensive care, and she never came out of there. This is hell, and when I hear this, I think, my God, where do they even find this? Well, here you go. Right now in Russia, there are 163 universities training doctors. 146 of them are under the Ministry of Health. The rest are faculties that appeared relatively recently. They've already graduated students, and by recently, I mean about 20 years ago. Some are under the Ministry of Science and Higher Education, and the Ministry of Health had no influence on their education. We can't forget that in the 2000s, Ms. Swartsova drove out, literally swept out, hundreds of thousands of doctors from Russian medicine. Not hundreds or thousands, but hundreds of thousands. I remember that in Moscow alone, there was a demonstration of 150,000 medical workers, doctors, who were expelled, fired from medical institutions, from hospitals, clinics, and these doctors had been trained in the Soviet Union by the Ministry of Health. And instead of them, they trained these underqualified people in ballet schools. I don't know, in what kind of institutes, in railway institutes, in mining institutes, what other institutes there are, I don't know, there. In the department, institute, or anywhere else, I don't know, and it doesn't matter. And so, here you go. These are faculties that mess up, just show such ignorance that, excuse me, if they studied at a medical institute, they wouldn't make it through the second or third semester. They wouldn't graduate. In our 6th year, after the last session, 5 people were expelled before the state exams. 6th year. After the last session at our faculty, 5 people were expelled. And it was so strict, it was so harsh. I mean, in terms of control. We had a few people, if I remember correctly, who didn't finish the institute. They failed the state exams. That was it. Goodbye. No diploma. They received a medical assistant diploma called Incomplete Higher Education. They could work as paramedics, but not as doctors. But here, unfortunately, we just have an abundance of stupid, uneducated, foolish, just plain foolish people who have no idea how the human body works. That's why now, doctors who are properly trained are worth their weight in gold. I'm serious. People who actually understand what they're talking about are worth their weight in gold. And if you need a doctor like that to monitor your case, then I invite you to join our deficiency elimination program, which is based on scientific data, on real scientific data. We never try to replace medicine. If you need to see doctors, I will tell you directly that your secondary condition requires medical treatment. I will even write a message to your doctor explaining what needs to be done, why, how, and what kind of management is needed, you understand. So, as it turns out, people like us are becoming worth our weight in gold. So, please, if you want a qualified person to work with you, I invite you to the Sofia Dorinskaya Medical Information Center, website dorinskaya.com. We will be happy to help you restore your health. Thank you. Goodbye.